Gentlemen, if you're over 60 and you've noticed that your morning strength has faded, your drive feels weaker, or your confidence is slipping, then listen closely. Today, I'm going to share something most doctors never talk about in their clinic. And no, it's not a pill, not a supplement, and not some expensive treatment. It's a simple 2-point pressure technique on your manhood and the surrounding area that can support blood flow and help many older men wake up harder every single morning. This technique is natural, safe, and surprisingly effective because it reactivates a biological reflex that slowly weakens with age. So stay with me, relax, and I'll guide you through everything step by step. Before I reveal the technique, you need to understand why morning wood fades after 60. As men age, blood vessels become stiffer and don't expand as easily as they once did. Nerves in the pelvic area lose some sensitivity, so signals from your brain don't reach the tissues as strongly, and overall circulation slows down, especially in the microvessels responsible for filling the erectile chambers. Morning erections actually happen because, during deep sleep, the brain sends blood to the groin to keep the tissues healthy and oxygenated, but when your blood flow weakens, that natural nighttime boost just isn't strong enough anymore. It's not a sign of weakness, and it's not something to be ashamed of. It's simply biology. And this is exactly why the pressure technique works. It gently reactivates the nerves and vessels involved in that automatic morning response. Now let's talk about the first pressure point. This one is found at the base of your manhood, the spot where the shaft meets the pelvic floor. If you place your fingers at the base and slide slightly inward, you'll feel a firm band of muscle. This is part of the bulbospongiosus muscle, a key muscle that helps pump blood into the erectile chambers. When you press this point gently but firmly, you stimulate the pudendal nerve, one of the most important nerve pathways responsible for sending arousal signals and triggering blood flow. Older men often have a weakened response along this nerve line, so pressing this point helps wake it back up. To activate it, simply place 2 fingers on the area. Apply steady pressure for about 15 seconds. Breathe slowly, then release and massage the area for another 10 seconds. Do not rush. The goal is to activate the nerve gently, not force anything. The second pressure point is located just above the testicles, right where the spermatic cord travels upward. Don't worry, this point should never be painful. In fact, it's one of the calmest and safest areas to stimulate. Place your fingers above the testicles and move upward until you feel a natural muscular ridge. This point is closely connected to the smooth muscles that control blood flow in and out of the entire pelvic region. When you press here gently, the muscles relax, and more blood can travel freely. Think of it like opening a valve. When this point loosens, circulation improves instantly. All you need to do is use 2 fingertips, press lightly for 15 seconds, then give the area a gentle massage for 10 seconds. This helps increase the overall blood supply to the region and supports the natural nighttime circulation that leads to morning erections. To get the most benefit from this technique, I recommend doing it in a simple routine that takes less than 2 minutes. First, warm your hands so your fingers don't shock the nerves with coldness. Then press the first point for 15 seconds, massage it, and move to the second point. Press that one for 15 seconds, massage it, and repeat the full cycle 3 times. The whole process takes about 90 seconds. Doing this routine before sleep works best because your body is naturally preparing for deep rest and nighttime blood flow. Over time, this can help reactivate the nerve pathways, improve microcirculation, strengthen the pelvic response, and support stronger morning erections. You're not forcing your body. You're simply nudging it back into the rhythm it naturally had when you were younger. You might be wondering how such a simple technique can make a difference. The answer lies in the science. When you stimulate these points, you activate vasodilation, which means your blood vessels open wider and allow more blood to enter. You also stimulate the pudendal nerve, improving the communication between your brain and your manhood. The pressure helps relax smooth muscle tissue, which is essential for healthy erections. It also helps oxygenate the tissues, something many older men struggle with because circulation slows with age. And most importantly, this technique supports nighttime blood flow, which is the foundation of morning erections. For many older men, these small biological boosts make a big difference. Of course, this technique must be done gently. It should never cause pain, numbness, tingling, or swelling. If you feel any of those things, stop immediately. This routine helps support circulation, but it is not a cure for deeper medical issues like severe diabetes, nerve disorders, or major vascular disease. If you have ongoing symptoms that don't improve, always consult a doctor. Your health comes first, and knowing what's going on inside your body is essential. But here's the truth. Age does not define your masculinity. Your body is capable of far more than you think. Your confidence can grow again. Your mornings can feel alive again. And your strength can return with the right habits. Simple routines like this pressure point technique can gently retrain your nerves, open your blood vessels, and help restore the firmness and vitality you thought were gone forever. You are not losing your power. You are learning how to reclaim it. If you found this helpful, make sure you subscribe to Stoic Pro for more natural men's health tips, circulation methods, and powerful advice to stay strong after 60. Your best years are not behind you. They're just beginning.